I put up.
Hello?
Mm.
Hello, no?
Mm.
A very good morning to our dear faculty. On behalf of Rosary College of Commerce and Arts, I extend a warm welcome to you all present here. Well, we are no strangers to stress. It is a natural feeling of not being able to cope with specific demands and events. However, stress can become a chronic condition if a person does not take steps to manage it. Given the unprecedented times, most of us have found ourselves in a perpetual state of stress. Today, to help us understand and manage our stresses better and employ ways to relieve it, we have among us Dr. Avinash D'Souza, a consultant psychiatrist and psychotherapist with a private practice in Mumbai. He has over 300 publications in national and international journals. He is one of the few psychiatrists who, in addition to a psychiatry degree, has an MBA in human resource development, a master's in psychotherapy and counseling, and an MPhil in psychology. Dr. D'Souza is also the founder of the D'Souza Foundation, which aims at carrying forward the dream of making community mental health a reality and to take mental health and wellness to the masses. His foundation aims to spread its wings and cater to the needs of everyone from young children to aging population of the society. Dr. D'Souza, we are glad to have you among us today. And without further ado, I welcome Dr. D'Souza to take over the session.
Well, good morning, everyone, and thank you for having me here. Well, I know we are in a state where we're having this session virtually. I mean, I would have probably loved to have, been with all of you all. And of course, I mean, I never miss an opportunity to go to Goa if I get a chance. So if, I would have been invited, yes, I would have definitely come, but that's fine. Besides that, the most important thing here is we're going to talk about stress management, and everyone knows what stress is. Okay, everyone knows what stress management is also. It's not that I'm going to probably tell you the same thing that five people who would talk on stress management would tell you, but I'm going to tell you a few things which I feel are little different and personal, and my own approaches that I look towards managing stress. And it's not going to be like a long talk. There are no slides that I have to share or anything that way. I'm going to just share with you my views, and then we would like to have a lot of interaction with you. So it's an interactive talk. The whole aim is not that I talk and you listen. I'll probably talk for a short time, and then we'll take up all the questions that you may have. So you can put it in the chat box, and I think the counselors would ask me and I'll answer, or whatever. We could try and see how that goes. Now, to start with, people always ask me, what is stress? How do I know that I'm stressed? I always say stress varies person to person. It's very difficult to say that uh, one person may be stressed by something, another person may not be stressed by the same thing. So stress is different for different individuals. There are some people who get stressed with, say, a college exam. There are some people who get stressed with uh, a practical. There are some people who get stressed with family. There are some people who get stressed with finances. So stresses differ person to person. Stresses differ across groups, which is very important. And what's also important and vital to understand is that the way we react to situations differs across people. So some people may react by getting anxious and worried. So they may feel ki ghabrat ho raha hai. They may feel that there's some chest pain, there is palpitations, there's something is going to happen. There are others who feel aggressive and they might get violent, they may get aggressive, they may shout, they may scream. You have others who feel low and sad. So different people react to different situations differently. There is no doubt that the last 2 years of our life have been very stressful. The pandemic has been one of the most stressful events of this century, maybe. We probably were different people when we were entering the pandemic, and we are now different people post the pandemic. We have adapted, we have changed, we have learnt, we have improved, uh, we have focused on the finer things in life, and that whole perspective of what life is, what we expect, what we want has changed post the pandemic. We have more and more people who are now more concerned about family, personal life, managing their stresses, and multiple other things. We also have more people who are now focusing on the finer things in life. The most important factor in managing your stress is that you have to learn to laugh and smile. I've seen some people, they don't laugh and smile at all. I mean, they're always serious. Whether you show them a photo of a beautiful girl or a bullock or a monkey, the same facial expression is there. That expression never changes. I don't know why they are so serious in life. It's very important that, you have to smile a bit, you have to laugh a bit, you have to share jokes, you have to crack jokes, you have to be part of, and if you don't laugh, your stress isn't going to reduce. Getting angry, getting upset is not going to just, take your stress away. So the first point is that we have to learn to laugh and smile more. The second aspect with regard to stress management is that we have to learn to accept things as they are. We have to accept what is there in our life. We have to accept what is. We have to understand that whatever is what is the truth. We have to understand that we may want to be something, we could have been something, we should have been something, we could be like this or should be like this is a lie. That's probably what we could be. But no, we are always looking to not accept the present, and we want things to be better than they are, which is not wrong, but it shouldn't stress us out. This is something which is also essential. We have a lot of people who have regret, and that's the cause of stress. Regret about the past, regret about a family issue, regret about something someone told them, regret about something someone did to them, regret about missing out on a job, missing out on an opportunity, regret about missing out on certain things in life. One of the key factors in eliminating stress is that one cannot have any form of regret in life. You can have some regrets about some things, but you can't let that regret transform into something that affects you. The more you have regret, the more unhappy you're going to be, and the more stressful your life is going to be. So, first, I told you we have to laugh more. 2, we have to accept more. 3, we have to have no regrets. 4, we have to focus on our physical well-being. So you have to walk daily, you have to eat mindfully, you have to be particular about your diet. If you have blood pressure, diabetes, any other illnesses, you have to take care of your diet, take care of your illnesses. So focus on getting your physical health done, which is very, very important. Your physical health is vital. Your physical health is very, very important. Your physical health is also important because your physical health determines your mental health. If you're physically fine, you're mentally fine. And your stress would automatically then reduce. Another point which is very important when it comes to stress management is your sleep pattern. Your sleep pattern has to be regular. Your sleep pattern has to be at a fixed time. You have to get up at a fixed time. You have to sleep at a fixed time. It's very important because if you get up and sleep less than 6 hours in the night or 6.5 hours in the night, it's going to be very stressful. I know a lot of people who tell me that we sleep around 5.5 hours, we sleep around 5 hours, and we manage. No, you can't manage. You have to sleep 6.5 to 7 hours. You cannot manage with less sleep. Your diet is also another very important factor. While you may eat whatever you like, make sure that you eat a lot of fruit, make sure that you eat a lot of vegetables, make sure that you eat a lot of salads, make sure that you can eat your fish and chicken, whatever you'd like, no problem. But make sure that you inculcate and incorporate all these things in your diet as well. A lot of people ask me, so what helps stress? Should I do yoga? Should I do meditation? Should I listen to music? I always say it is highly individual. So there are some people who like to do yoga. Yoga helps them. There are some people who like to do meditation. It can help them. There are some people who like to listen to music. It may help them. There are some people who like to talk to their friends. It may help them. There are some people who like to dance. It may help them. You can take up a variety of hobbies. Some hobbies include, learning to make some objects at home, cooking, baking. You can take up gardening. You can take up other activities like singing, learning a new language, multiple things that you can take up online, which would help you from a stress perspective. Another very important factor when it comes to stress management is being happy in your life. Be happy that you have certain things. Don't be unhappy that this is there and that is there and this is not proper and that is not proper. Be happy for the way things are. Be happy whether the way things are. Don't be unhappy that the other person has this, I don't have this. Don't compare too much. Even if you compare, you can't afford to feel sad and unhappy with that comparison. A very important key question that people ask me is, what is stress? How do I know I'm stressed? You'll know you're stressed, if you're getting more angry, irritable, you're feeling more sad or anxious, you're not able to focus on your work, you have headaches, you have body ache, you feel panicky, you have acidity, you may have constipation or diarrhea, you may not like to go to work in the morning, you may sleep more or you may sleep less, memory, focus, and attention gets affected. Another very important facet is that a lot of people tend to believe, oh, this is normal. Stress is not normal. Stress means you're deviating from the normal. You need to get yourself assessed if you're having stress. In Mumbai, we have a lot of people who have a lot of issues when it comes to visiting a mental health professional. The answer here is that you can visit a counselor if you feel stressed. There is no shame. There is no stigma. There is nothing negative in visiting a counselor. Lot of people feel if I visit a counselor, people will think I'm mad. No, no one will think you're mad. If I visit a counselor means I am probably incapable of managing my problems on my own. No, not at all. If I visit a counselor, she is going to diagnose me with a psychiatric problem. No. A counselor or a therapist will talk to you. She is trained or he is trained scientifically to speak to you. They will give you guidance with regard to certain problems. They may refer you to a psychiatrist if they feel that your problem is a lot. And if the psychiatrist feels you need any help, he may suggest it to you. But visiting a psychologist, psychiatrist, counselor, mental health professional when you're stressed does not mean that you're mentally ill. It primarily means that you're taking help so as to get rid of the problem at an early stage. What happens if I neglect stress? Well, it can become a full blown condition. What happens if I neglect stress? I develop medical problems. What happens if I neglect stress? I lose weight. What happens if I neglect stress? I may get appetite issues and sleep issues. So, there are multitudes of effects that you can see that can occur as a result of stress. Who can get stressed? Everyone. Children have their own stresses. School going children have their own stresses. College going children or adolescents or teenagers have their own stresses. Middle aged people and adults have their own stresses. People in old age have their own stresses. So anyone can experience stress. The transition from offline education to online education has also been stressful for many people. We've had many people who have had issues with regard to adjustments. We've had many people who have not been able to manage their problems. We've had many people who've had a lot of issues when it comes to anger. Another very important component of stress is anger. A lot of people harbor anger in their heart. She did this, she said this, he did that, he said that. So a lot of people harbor anger in their heart. A lot of people harbor hate in their heart. Remove that hate. Remove that anger. Do not keep that in your heart. If you keep less hate and less anger in your heart, life will be less stressful. There are times when family members may not see on the same page, may not see eye to eye. They may not agree with what you're saying. We have to learn to respect that family members can and will think differently. We have to learn to respect that family members can have differences of opinion. We have to learn to respect those differences. We have to learn to accept those differences. We cannot expect family members to think at the same level as we think, and they may not be united together thinking about the same topic. It can happen that there will be differences. So many couples, husbands, wives keep fighting and are under stress. Why? The only reason is a lack of clear communication. The only reason is not being able to speak to each other openly and to discuss what bothers them openly. I remember, even for that matter, teachers feel stressful. Even for that matter, parents feel stressful. Even for that matter, many people feel s- stressful for no reason. Sometimes feeling anxious, feeling upset, feeling angry can also be genetic. It could run in families. There may not be a cause always. If you had parents who were anxious, there is a high chance you will be anxious. If you had parents who were sad and low and depressed, there is a risk that you may feel depressed. So always look at genetic factors that may cause stress. Always look at environmental factors that may cause stress. There are multiple factors that can be modified. Modify them, change them. There are multiple factors that cannot be modified. We learn to live with them. There are some factors that can be changed partially. We change them. Stress management has to begin today. Stress management has to begin the very moment you decide you want to take control of your life. Bring in exercise, bring in positivity, bring in a lot of positive things. Do not imbibe negativity. Do not imbibe negative aspects of people's lives and personalities. And you will automatically feel less stressed. Exams for professors and teachers are a stressful period. Paper correction is a stressful period. Submission of everything online is a stressful thing. So, stress is there with you at every stage. It depends on what we do to combat that stress. Choose some time of the day which is your time, where you do whatever you do. Choose some time of the day where you learn and do whatever you want to do, because that is very important for you to be stress free. I would want all of you to remember that life is never perfect. You will always have ups and downs. But the most important fact is not to look at the ups and downs with regret and anger, but to enjoy the journey. One has to enjoy the journey called life. That's most important. Those are my thoughts on stress management. If you feel you have any questions, I'll be more than happy to answer them. And I'll be more than happy to discuss anything that you would like to discuss. You are all teachers and non teaching staff, and I'll be very happy to interact with you all. Thank you. Yeah. Is Rosary there or anyone there? Yes. Yes, Frina, you has raised a yes. I think you all can raise hands and I will then ask question. I think commerce, Rosary, it's written here. Is there?
Yes,
Yes,
yes.
yes, yes.
Good morning, doctor.
Good morning. Yeah.
Yeah. Thank you for your insights into stress management. 2 points I would like to make rather than questions.
Okay.
Over the years, I feel this is a little like a misnomer. This
Okay.
stress management, don't you? I feel I- stress is always going to be there. I think, as you said, shouldn't it be like how we manage ourselves in these situations instead of talking about managing something like I don't know. That's one point. If you can highlight on that. And regarding sleep, there are a lot of there's a lot of research coming with the number of hours with sleep. And some of the people in India believe that you can manage only with just 4.5 hours sleep for an adult. So, where do we stand with regards to this piece of?
Well, I think four
Thank
and
you.
a half hours of sleep is being very brutal on yourself. And if you manage with that, you're going to land up with a lot of medical illnesses. So, my whole premise is that you have to sleep at least 6 hours to 6.5 hours. Only if you do that will you be healthy. 4 hours is 4.5 hours is very, very less.
Thank you. Because
Yeah.
it's been said that it's like the Western concept of like introducing these sleeping pills and things like that. So,
No, you don't need sleeping pills. There are a lot of other things which you can get good sleep with, but at least 6.5 hours.
thank you.
Yeah.
Doctor, I think there is another query by Ma'am Veena. Ma'am Veena, can you ask your question, please? Ma'am Veena, am I audible since you raised the query?
No, I think a hand was raised from the beginning by mistake. Maybe it was, yeah.
I'm sorry, it was by mistake.
Yeah,
I'm
yeah, yeah.
extremely sorry.
No problem, no problem.
Is there anybody else who would like to ask question? You can even type it in the chat box so that I can convey it to the doctor. Anyone?
Yes, yes. Commerce Rosary has raised her hand again. Yes, yes.
Okay, there's Rolita as well there asking, but just that uh, some another point you made, doctor, is regarding anger. No, as
Yeah.
one of the, yes, there is something called anger as angry, and because of many things also. No, but sometimes what I feel is grief also is overlooked in the process of being anger. So how would you say? Because many times people are really not angry; they are really in grief. They're in pain. So how would you like to? What would you like to say
Well,
there?
I always say that when it comes to anger, we have to look at what is the cause of anger. Is it a person, is it an object, is it a situation, is it anger against the self? What is the reason? And then we look at the anger management based on that. I always say anger is not a destructive emotion, it's also constructive emotion. So you can use anger positively, you can use anger negatively. It totally depends on the person who's managing the anger and how he's managing it. So I feel that yes, anger could be a part of grief and pain, and that is something that would have to be looked into. But beyond that, uh, I would just say that it's how you manage your anger that matters. uh, Someone has asked me, does stress affect males and females differently? The answer is, well, I think the male body is different, the female body is different, the female hormones are different, the male hormones are different. So stress does affect the male brain and the female brain differently. Men respond to stress differently. They're more aggressive. Women respond to stress in a more calm manner. Women are also more thoughtful and plan well. Men sometimes can be more impulsive. Men do not express their stress, and therefore they keep it within them and are more prone to medical conditions. Whereas women, on the other hand, will express their stress openly to friends and others, and therefore they find some solace in people outside who they can speak to. And the effects of stress are also there. Someone has asked me, how do you overcome stress due to grief? Well, grief is what you experience when there's a loss of a loved one. And grief can take anywhere between 1 month to a year to sort of resolve. It depends person to person, it depends on multiple factors. So it's very important that uh, you have to undergo what we call grief counseling. You have to look at why you're upset, what your relationship with the person was, what does the loss of the person mean to you, what are the factors that have affected your grief. And all this is done in a grief therapy kind of setting, and that can help you to overcome your grief. What are the first few steps in dealing with stress management? I think the first few steps are that you identify things that stress you out, see what you can avoid, and see what you can't avoid. And if you're eliminating a few situations, your stress reduces. But there will always be some situations where you need help and there is stress which comes up because of those situations. You try and modify the way you are um, probably reacting to those situations. And I think those are the first few steps in stress management.
Uh, Doctor, I have a small question to ask. Since because of stress, a lot of people immediately take medication. So, do you think that is the right way, or what can be done?
Well, I think there are non-medical methods to combat stress also. So people could probably seek help from a counselor, a stress management consultant, try and see what can be done. And if the non-medical methods don't work out, then medication is an option. According to me, only 50% of patients that come to me need medicine. Not all need.
So, initial steps that what are the initial steps do you think immediately as a person faces the stress? What do you think?
Well, I think, see, there are two situations here. If someone is very stressful and is getting a panic attack at that point of time, you may have to medicate him at that point of time to relax. But after that, you try and identify the cause of the panic attack, the triggers, and multiple other things, and therefore you try to avoid, that sort of happening in that stage. So you can probably work medically as well as non-medically.
Thank you, Doctor. Um, to all the teaching and non-teaching staff of both the colleges, if there are any other questions that you would like to ask Doctor, please you can put in the chat box and ask your question, please.
I would love to know from the teachers, how, means, see, in every college we have three groups of teachers. We have younger teachers, we have teachers who are, I won't use the word middle age, but I'll say 10 to 15 years of experience, and you have some senior teachers. So what I want to know is, how have you all felt adapting to online teaching? How do you feel? And see, at a school level, it's very different. You can control the children, and you can tell them sit down, and at a college level, online teaching is very different. So how have you all adapted to online teaching? I mean, do you all like it, don't like it? According to me, it's good in a way, but there's definitely the chalk and the blackboard in the classroom, and there's no substitute for that. But the thing is, how have you all felt after nearly 2.5 years of online teaching? I mean, anyone could share or type, I don't mind. Someone has asked a question on sleeplessness. 1 minute. Sulekha will have to keep herself mute. Uh,
Ma'am, Ma'am Sulekha,
yeah, she's muted. How would you remedy sleepiness due to stress? Sleepiness due to stress is primarily uh, a symptom of escape when you can't handle the stress. So you'll probably have to, have a cup of coffee, wash your face, do some exercise to keep you awake and alert, and face the stress. There's no other way out. There is no medication to avoid sleepiness. You'll have to sleep well at night. Automatically, you'll be better in the day.
I think there is no more questions. I would like to take this time to thank you, Doctor, for enlightening us with your enriched knowledge. I would also like to thank our principal, Dr. Harry Palato, and our administrator. Uh,
Okay, sorry. Veronica has just mentioned that it's sleeplessness. Well, I think then you need to look at what is causing your sleeplessness. So your sleep timings have to be proper. Your bed has to be good. The light has to be dim. Nice music. Have a hot bath before sleeping. Drink some hot chocolate if you want. I mean, do things which will make you feel relaxed. That's something which is very important. In a worst case scenario, you may need medication, but not always. You can manage it non-medically also. Sorry, I interrupted you. Yeah, yeah,
that's fine,
yeah.
Doctor. I would also like to thank Dr. Father Gabriel Coutinho and my partner Kimberly Fernandez and the principal of higher secondary and all the teaching and non-teaching staff who have helped us to put this together. And I hope everybody has got the knowledge and are able to use and make the difference that is needed. So right now, what we are going to do is that I'm going to give you a stress management feedback form on the link. I will be sharing it on the chat. please click on that link and please give your feedback, because your feedback is very, very important for us so that we can improvise our services for you. Thank you so much.
Thank you. Thank you.
I request all teaching and non-teaching, please click on the link below and please give your feedback. As mentioned earlier, this is very, very important for us so that we can know and understand what do you all need. I understand that you all go through some stress every day and it's not easy to handle it, but definitely we are making a small attempt from our side to give you the as much as help that we can provide. Thank you.
It won't give us